It is no more news that the Delta variant has made its way into Nigeria.
The Nigerian government has officially confirmed that the third wave of the coronavirus pandemic is already in the country. Both the Lagos State Governor Babajide Sanwo-Olu and the Nigerian Health Minister Osage Ehanire made this disclosure at different events while speaking on the growing number of the virus infection across the country. The Governor of Lagos State announced that since last week, an average of 6 deaths have been recorded daily from the disease in the coronavirus epicenter.
Let me assure you and make it clear that the necessary sense of alarm should not be responded with a panic, but instead we should resolve and we should be more determined to reverse the trend. We have done it before and I believe we can do it again. We dealt with the first and the second wave and we did our best indeed to prevent this third wave. Now that it's fully upon us, we must dig deep with what we have learned from the first and the second wave, and as we summon the will to do everything necessary to bring down the numbers on the way to eventually defeating the virus once again by all of us.
In his address at a national briefing by the Presidential Steering Committee on Covid-19, Mr. Ehanire confirmed that, like in many other parts of Africa, Nigeria has begun to record a sharp increase in the number of confirmed Covid-19 cases since the month of July as global anxiety over the Delta variant spreads. While corroborating the minister, Mr. Sanwo-Olu noted that despite efforts to prevent another wave from hitting Nigeria, the third wave has already arrived. Giving the statistics, Mr. Sanwo-Olu said since the outbreak of the pandemic in 2020, Lagos has recorded a total of 64,032 infections, with 56,336 recovering in community. He, however, noted that currently a total of 2,755 cases are being managed actively in community, while 5,029 cases have been admitted into the state coronavirus care centers. Lagos has also recorded 390 fatalities, 30 of which has taken place in this current third wave of the pandemic.
For all non-travelers who have been diagnosed positive, isolation, we believe, is mandatory. Anyone caught breaching the isolation protocols will be subject to a host of sanctions and penalty, which of course might include, like I said, prosecution. I think it's also very important for us to mention at this junction that only state accredited medical facilities can manage COVID-19 cases. There are state accredited public health facilities, which are the isolation centers, at IDH, at Bagada. We're planning to see if we should open up the indoor isolation centers. We're checking our numbers and we're trying to prepare that place. But we also have privately designated, hospitals that can also manage COVID cases. These are the ones that we believe have been accredited, and these are the ones that we hope that people would go into and get treated.
While speaking on vaccination, the governor lamented that only 1% of the state residents have received 2 doses of vaccines. He said his administration is working hard towards ensuring that at least 60% of the residents are duly vaccinated. On nationwide vaccination, the federal government of Nigeria explained that the newly donated 4 million doses of Moderna vaccines by the United States are currently being assessed by the National Food and Drug Administration and Control and would soon be distributed to states when approved for use. Kamil Sadiq reporting for CBA TV, Nigeria.